Good morning. I am Dr. Jacob Thomas. I am an MD Medicine and a DNB Medicine. I have done my MD from JJ Hospital, Mumbai, and MBBS from GS Medical College, Mumbai. And I have been in practice for more than 20 years, and I am a physician and a preventive cardiologist, and also dealing with infectious diseases. Today we are going to discuss about malaria. Malaria is a rampant problem in our country. Even after 70 years of independence, we haven't been able to eradicate malaria, and there are many factors for this. But in today's session, we are going to discuss the different types of malaria and how we can detect it, diagnose it and treat it, and above all, how we can prevent it. So in India, there are two types of malaria. One is called P. vivax malaria, the second is P. falciparum malaria. So this is caused by what is called a plasmodia, which is a small microscopic organism called protozoa. This protozoa has two hosts. One host is mosquito, the other is man. So the parasite, that is the protozoa P. vivax or P. falciparum, they go from the mosquito to man and again to the mosquito. There are different types of malaria in this world. One is Plasmodium ovale, Plasmodium malariae, but these two luckily are not found in India. And the P. vivax malaria is caused by the infection of an Anopheles mosquito, and P. falciparum is caused by an infection of Aedes mosquito. Aedes mosquito, you may be aware, also is responsible for the spread of dengue and also chikungunya. It also spreads yellow fever, but luckily that is not present in India. It is present in many parts of Africa. So what is the life cycle of Plasmodium? So what happens is, when the mosquito bites an infected person, the blood which is infected with the spores or sporozoids of P. vivax or P. falciparum enters in the salivary gland and then the intestine of the mosquitoes, and in the intestine they enter into the blood circulation and they start multiplying, and then they find themselves into the salivary glands of the mosquito and they clog the salivary glands. And when this mosquito again bites a human being through the saliva, so when the mosquito bites it, first it injects some saliva into our body, into our skin. That saliva for the mosquito, it acts as an anesthetic effect so that we don't feel the pain of the mosquito bite, and therefore many times the mosquito bites us and we are just not aware of it. The second function that the saliva of mosquito does is that it prevents the blood from clotting. So because of these two important reasons, the mosquito has to inject some saliva inside our skin, but the plasmodia is so smart that it goes and clogs the salivary gland and it therefore enters our body through this saliva. And when it enters the capillaries, it goes into the blood circulation and in the liver, and it multiplies in the human host. And when the multiplication reaches to a great extent, that is the time when the person becomes ill and starts developing fever and chills, etc. And this cycle therefore repeats itself. Another mosquito biting the person, the same cycle will keep on repeating itself. So there are some changes in different life cycle of different plasmodia. Vivax and falciparum may follow certain different life cycles, but more or less it is what we have described just now. Plasmodium, which when it enters the human body, it enters the red blood cells and it multiplies inside the red blood cells, and it multiplies, forms a great number inside the RBC, and it breaks the RBC or destroys the RBCs, and many sporozoids or plasmodia are released which infects other blood, that is other blood corpuscles, that is the RBCs, and therefore malaria starts destroying the blood or the RBCs of the body. It also clogs the liver. The liver tries to fight back, and in doing so the liver enlarges. At the same time, it also clogs the spleen. The spleen's job is to remove all the deformed or infected or the dead RBC, WBCs, platelets, and therefore the spleen tries to destroy the RBCs which are deformed or infected, and that also results in the spleen getting enlarged, and at the same time destruction of the RBCs and the spleen destroying the RBCs results in anemia or a lowered hemoglobin. So what are the clinical features of malaria? So after the bite of mosquito, if you get infected, it takes about 5 to 14 days for the parasite to multiply in the human body, and the person will start getting fever. It will be moderate to high degree of fever with lot of chills and rigors, a very unpleasant feeling, body aches and loss of appetite, lot of weakness and headache. In Plasmodium falciparum, the parasite can enter into the brain causing cerebral malaria, and in the brain it starts clogging the small arteries of the brain, causing a diffuse lack of oxygen in the entire brain, and that is called encephalopathy like picture. Confusion, drowsiness to unconsciousness can occur in cerebral malaria. Plasmodium vivax does not enter the brain and therefore do not cause cerebral malaria. Nowadays, we have often seen that the platelet count also reduces in malaria, not to that great extent as in dengue fever, but it does reduce, and this is because of direct suppression of the bone marrow and also because the spleen is enlarged, and therefore it destroys along with RBCs some amount of platelets also, and therefore in the blood count picture you find an anemia, that is a lowered hemoglobin. The WBC count may be normal or slightly high or low, but the platelet count may be normal or slightly low. And when we do a peripheral smear, we can detect the malarial parasite. The fever can come daily, alternate day, or once in 3 days depending upon the type of malaria. But this pattern is not classically seen nowadays. Why? Because many mosquitoes may have bitten the same person, and therefore the blood stages of the parasite will be, different stages will be present at the same time, and therefore we generally see near continuous fever which is occurring. Secondly, most of the patients are inadequately treated, and therefore some stages are suppressed, and therefore fever pattern is not what it used to be classically seen maybe about 30 or 50 years ago. And so clinically to diagnose this fever is not very easy nowadays. All these illnesses, that is malaria, dengue, typhoid, viral fever, chikungunya, etc., present as practically the same picture of fever with chills and body aches, headache, backache, with only certain differences among them. So in the lab test that we described, we do a complete blood count, a peripheral smear, malaria antigen test can be done, and in some cases where the diagnosis of the fever is uncertain, we may even have to resort to liver biopsy or bone marrow biopsy, along with certain other routine tests to assess the liver function, which can be deranged, and the renal functions. So what is the treatment of malaria? We have to ask the patient to have bed rest, soft diet, liquids, and anti-malarials like chloroquine, quinine, metakelfin, and the herbal type of medications and Chinese medication, which is artemether, artesunate, arteether. These things are used. Primaquine, etc., are used in the treatment of malaria. The Plasmodium vivax can recur after the fever settles down because the liver has some sporozoites or spores of this Plasmodia which remains there for 2-3 months, and the fever may recur. Plasmodium falciparum, if it's cured one, does not recur, but you can get reinfection with both Plasmodium vivax and falciparum if you get a mosquito bite again. Now, my advice would be to not neglect fevers, because fevers can be very dangerous and it can lead to morbidity and mortality also, and that is why as soon as you get fever, go and consult your doctor. If necessary, do not be very hesitant to do blood tests, because that will clinch the diagnosis, and based on a diagnosis with peripheral smear or antigen test, immediate therapy should be initiated. And if there is very high continuous fever, dehydration, persistent vomiting, inability to eat, severe headache or signs of cerebral malaria or low platelets and bleeding tendencies, etc., the patient should be admitted. How do we prevent malaria? At our local level, we can use mosquito repellents, skin ointments which repel mosquitoes, because remember the P. falciparum mosquito, that is Aedes, which also causes dengue, bites during daytime also. Classically, it is present in the decks, your working desk or your school bench, under your table, where it's a little dark and shady. The mosquito is present there and they can bite you, and you can get even during daytime. The Plasmodium vivax mosquito, that is Anopheles, bites only during the night time, and therefore during the night we can use mosquito repellents, and mosquito nets can be effective. But within the house, we should see that the AC vents should not be filled with stagnant water, because mosquito can breathe there. Also, refrigerators should not have stagnant water lying outside. And in the society, the spraying of gutters, and filling of ditches, etc., not allowing stagnant water to accumulate, and keeping the surroundings clean, etc., is very important, and prevention of water accumulation is also important. Thank you.